or COPD or any other kind of immunocompromised disease, they must go for this annual shot of influenza vaccine. Now, basically, influenza A and B both are covered. You have the subtypes and lineages that are covered, and influenza will prevent you from having rippling colds and the connective complications. So, do get your influenza shot.
So I'm going to talk about typhoid vaccine, which is now also needed for the adults. Both inactivated or the live vaccine can be taken just about 2 to 4 weeks before your travel history, and then the booster can be taken every 2 years or every 5 years respectively. So please do make an effort to do that and create awareness for all the adults in the family. Thank you.
Hepatitis A vaccine was one of the earliest vaccines. It's a highly effective, time-tested vaccine, should be taken by all. It helps us in preventing some of the serious complications and problems that can be associated with hepatitis A. People who are carriers of hepatitis A can be asymptomatic, so you never know who's a carrier. So giving vaccines prevents this from happening. It creates a herd immunity which prevents the spread of any epidemic of this disease. And also, if you are traveling a lot, you are traveling to various places, as this can be transmitted by food and water, one should have hepatitis A vaccine because you don't know where you are traveling and where you can get the risk of this vaccine. So please do consider taking hepatitis vaccine regularly. Thank you.
Hello all, this is Dr. Supreme Sandhu, consultant at Royal Hospitals. I will be talking about TDAP vaccine. I'll try to be as short and explicit as possible. So this is taken in pregnancy, usually through 27 weeks to 36 weeks of pregnancy, that is third trimester. Why? Because it is for whooping cough, for the pertussis, and tetanus and diphtheria. So the antibodies, they are formed in the third trimester, which is passed on to the baby. So that's why it is to be taken in third trimester of pregnancy. That's it. Thank you so much.
Hello everybody, I'm Dr. Praveen Sodhi. I'm a senior consultant laparoscopic and GI surgery. I'm talking about hepatitis B virus. Now this virus is so prevalent. India has about 40 million carriers at this date. And about 25% of these would go on to develop chronic liver disease, liver cirrhosis and even liver cancer. And believe me, hepatitis B is a completely vaccine preventable disease. In 2011, the National Immunization Program introduced this vaccine for the infants, and the vaccine starts as soon as they are born. But those adults who have not received this vaccine and those who are at high risk for getting the disease, like healthcare workers like us, we all have to get our titers tested and get yourself the vaccine if you haven't received. The doses are 0, 1 and 6 months, and it's a very safe vaccine. It will definitely protect you from this scary illness. Thank you so much.
Hello, I'm Dr. Paki Agarwal, Senior Consultant in Gynecology, Oncology and Robotic Surgery. I'm talking about HPV vaccine to prevent cervical cancer. Cervical cancer is one of the most deadly cancers, and India has 1/4 of the global burden. But the good news is that it is almost entirely preventable by vaccination. This vaccine is given between the ages of 9 and 26 years in a 2 or a 3 dose schedule. And it covers the common types which are known to cause cervical cancer. And now the good news is that in India we have an indigenously made vaccine which is 1/4 of the cost of the vaccine which we were importing from outside, and it should be given to all young girls, women before marriage and before the onset of sexual activity. Thank you.
Good afternoon everybody. My name is Dr. Vinny Kantru. I am a senior consultant in the Department of Respiratory Critical Care and Sleep Medicine. I am going to talk about pneumococcal vaccine. So we all know in elderly population the most common cause of death sometimes is pneumonia. So pneumonia is preventable, especially the invasive pneumococcal disease, which means that your body has some immunity to fight off a sepsis kind of a situation where any of or every of your organ can get affected. The population which can receive pneumococcal vaccination is more than 65 years of age, or those who have some comorbidities can be given based upon your doctor's evaluation. So do get back to your doctor and ask for this vaccination, which is very, very good in terms of preventing this invasive pneumococcal disease. Also, I would like to reiterate that this vaccine can be given in two forms. One of them is 23-valent, the other one is 13-valent. The 13-valent has less number of serotypes, but it is very good immunity causing agent. So hence this can be given first, followed by the 23-valent vaccine, which is given to cover the other and the rest of the variants which are seen in this kind of bacteria. Thanks for your patient hearing.
I'm Dr. M.S. Kamar. I'm Senior Consultant in Pulmonary Critical Care, Sleep Medicine, and also lung transplant. You've heard about all the vaccines. General public generally knows about the childhood vaccination program, and as I was told earlier, that you have a schedule and you maintain a booklet. So all those things are well known, but what is not well known is adult vaccines. You've heard about that. So adult vaccines can prevent in large numbers the certain diseases, and in certain comorbid conditions, immunocompromised patients, old patients, this could again prevent or minimize the effect of the disease. It doesn't always prevent totally, but if it minimizes the effect of the disease, well, you have achieved what you want to do. So that is how it should be looked at, and I think we implore the public to actually consult with their treating doctors to see the probabilities of which vaccines can be used at what time, that's very important. Age is not always very relevant. What is relevant is other comorbidities which make you more prone to develop these diseases. And remember, mind you, some vaccines will be coming to prevent cancers, more cancers. So wait for that, and probably in 5 years' time, we'll have more good news to give you. Thank you very much.